Hi Irene, I just wanted to know, I've got a crown which I think is on an implant. It feels loose and it feels like it's going to drop out, and the gum around it feels really kind of soreish. What can I do? Because obviously there's no dentist open.
I can see why you will be concerned. Anyway, during this period, there's some advice that I've prepared that I can give you. Okay, so first of all, you've asked about your crown being loose. So if we look at this model here, this is an implant. I believe this is what you're talking about.
Yeah.
So you've got the crown and the crown has come off, and you probably are putting it back yourself and it's loose. Now, if you've got a situation like this, this is not classed as an emergency this period. So you would need to stick this crown back on yourself. So what you can do is go to the pharmacy and ask for something like this, Fixodent or Polygrip.
Okay.
There are other temporary dental cements in the pharmacy, but you don't want to use any of those ones because you can cause more problems for yourself.
Okay.
So I'm just going to show you how to use the Fixodent to put the crown back, okay?
Yeah.
Now, when you first get the Fixodent, you get a little bit of fluid come out, so you want to remove that fluid first. So once you start to see the pink stuff come, you put a little bit, very little bit, please, in your crown. Okay, so get something that is small enough to go inside the crown. And remember, do not put too much. And then you can then stick it on. Okay.
Okay.
So that's there. You see, I'm trying to pull it off. If you pull hard, you can get it off, but it will stick long enough for you to be able to go around and eat something. Now, once you've stuck this on,
Yes.
do not eat anything sticky. So no chewing gum, no toffees.
It's Easter.
Well, I'm afraid you need to avoid certain foods.
Okay.
Okay? Otherwise, you're going to swallow your crown.
Okay.
Okay? You don't want to do that. All right? Okay. So you see, it can come off, but you just need a little bit. You might need to do it again the next day or in 2 days' time, but it's safer to use this material until the lockdown period is over.
That's the stuff for the dentures, right?
It is the same stuff for the dentures. It's called Fixodent, or there's another brand called Polygrip.
Okay.
Okay? Denture material. Okay. Now, there's another kind of implant crown you can get, and I'll just talk about that now because some people have these kind of implant crowns. They're screw retained. So when the screw is tight, the whole crown will come out.
Okay.
Then I'm afraid you would have a gap. But until that happens, if it's loose, so as you can see, it's now shaking.
Okay.
Now, if you have a situation like this, do not keep on rocking it because you're going to make it worse.
Okay.
Okay, so don't keep on moving it. Don't start showing it to your partner. Say, oh, look, my tooth is loose. Look, you're just going to make it worse. What you need to do at that period is avoid any foods that will make it worse.
Okay.
So don't bite with your front teeth. Just maintain a soft diet. But while this is happening and while we are at the lockdown period, you want to make sure that you're cleaning around that tooth a lot more than before. So I'm going to show you with a dental floss how to clean. So if you just hold that steady, thanks. So I'm going to put the floss down the side through the contact point. So, and you make it into a C. I don't know if you can see me, or if I go down this side here, and we make it into a C, and then slide underneath the gum. So if you look this way, so you see that it's gone underneath the gum here. So slide underneath and move it back and forth and then pull through. Okay? Same the other side. Go underneath the gum, slide it back and forth, and then pull through. Do not try to pull upwards like that. That will make your crown even more loose. So just make sure you pull it through, not back up like that. You don't want to do that. That will just make it worse, okay?
Yes.
So that's for your dental floss, okay?
So do I brush the same way?
It depends on how you've been brushing before. So I'm just going to use the same time to tell you what you should do. Now, many people, when they're brushing, they just go like that. Best not to do that. Since this is rotating, you want to give enough time for this to actually clean the tooth.
Okay.
So when you go like that, you want to count 1, 2, 1, 2, 1, 2. When I tell the patients, I normally say to them, while you're counting the 1, 2, can you angle to one side of the tooth and the other side? So 1, 2, 1, 2.
Okay.
This is just to allow the bristles to get in between the teeth.
Okay.
And always remember that you still need to come to the top and also brush the inside. Okay?
Yep.
Right. Now, having said that one, I will tell you also about cleaning under an implant bridge. So if you could just hold this one steady for me. You see, this one has 2 implants and 3 teeth on it. Now, when you're cleaning this kind of restoration, which is an implant retained bridge, we're going to use a different kind of floss, which we call super floss. So I'm going to show you here. You've got a thin part and a fluffy part. Okay, good. So what we want to do is go in between the tooth that is on the implant and thread it through. So if you just help me hold that steady there. So we're going to go underneath that until we get to the fluffy part and slide it underneath the bridge. You see how it's going underneath?
Yeah. It doesn't even pull it out. Wow.
Now, you don't want to then come up because you're going to dislodge your bridge or you're going to make it loose. So once you've done that, then you pull through.
Okay.
Okay, so we do one more time. We pass the floss through. We slide underneath the bridge.
Okay.
And then we pull through. So if you did this even once a day, it will clean all the debris that has trapped underneath your bridge. But remember that you still need to floss in front of your implant, which you can do with regular floss, or you can use the thin part of this floss.
Okay.
So you can go beyond the fluffy bit and then again make it into a C, much the same way that I showed you for the single implant crown. Go underneath the gum and then pull through.
Okay.
The same you do for the back as well.
Okay.
Okay.
Yeah.
So some people use the power flosser. Okay. Most times you have like an electric one, but this one is the same one. This one you don't need to charge because it's mechanical. Now I'm going to show you the box of this one. The diagram on the box kind of tells you to angle the power flosser upwards so it's going into your gum.
Yeah.
If you do that, you're going to end up pushing debris underneath your gum, and you don't want to do that. You want to be angling away or making sure that whatever pressure, the water and pressure that you have coming out of this has an exit point.
Okay.
And I'm going to show you what I mean. So if we go to the model here, you can see that there's a space underneath your bridge you want to floss. So you don't want to angle this way and use the water and air to push into your gum. What you want to do is flush like that. You see how it came out the other way?
Yeah.
So any debris underneath this will come out the other way. It's just going to push that debris out. So you don't want to push any debris right underneath your gums. Okay? So that is how to use the power flosser. You can use the power flosser in between your teeth as well, but make sure that you have an exit point. You don't want to be pushing into your gums.
Okay.
Okay? So I'll just get the water out of that. Yes, and what haven't we covered? Sometimes, I mean, what else?
So if, as I was saying, my gum feels a bit sore, what can I do apart from cleaning? Is there any mouthwashes or that I can use?
Yes, there are. You can use Corsadil mouthwash that you can get from the pharmacy, but also you can use Minimint, which has got peroxide in it. At this time, it is really good to use Minimint.
Okay.
Or a mouthwash with peroxide.
Okay. Any
mouthwash with 1% peroxide is very good because actually that can reduce the viral load in our mouth this time. If you have a swelling and you get this funny taste in your mouth, did you want to see this one, the Corsadil one?
Oh yeah.
Yes, this is chlorhexidine.
Okay, this is different to the one that you usually sell.
Yes.
But the same thing.
It is the same thing.
Okay.
So if your pharmacy hasn't got Corsadil, you can just ask them for chlorhexidine mouthwash. Okay. You have to make sure that you're not allergic to chlorhexidine though. Okay. Yes. Apart from soreness, you can also have a bit of a funny taste in your mouth around your implants. If you have a funny taste, you probably have an infection.
Okay.
And there's something serious going on. But during this period, you need to definitely call your dental practice so that they prescribe you some antibiotics. They might not be able to do anything this period, but you do need some antibiotics. But what you can do at home is that if you have implants and you find that around that area you have a swelling or you get the discharge, go put your finger lower down, as low down as possible, and massage upwards.
Yeah.
Keep massaging upwards. You can also go from the inside as well.
Okay.
You know, in case that's where, well, hopefully this won't happen to you. But if I put this back in, actually, I'll leave it out for now. But let's pretend it's there though. But you want to massage upwards towards the gum. So start from the bottom and massage upwards towards the gum, the junction between the crown and the gum, so that any pus or any poison that is stuck in your gum, it's finding its way out.
Okay.
But you still need to contact your dental surgery for some antibiotics.
Okay.
And immediately the lockdown period is over, go in because there's something serious going on. Okay. Have you got any other questions?
No, I feel pretty confident treating myself at home if I have to, and I can call you anytime I need, some help as well. Thank you.
Thank you so much, Denise. I hope that you keep safe this period.
Thank you, and you too.
Thank you.